So there are different ways to test that 4 points cortisol. And one of the ways is to do it is in blood. And it's very, very hard to do a cortisol test in blood. So traditional medical doctors or traditional medical offices don't tend to do any type of cortisol testing except for an early morning cortisol. And it doesn't give you an idea of what's going on. You really need the flow of what the cortisol is doing throughout the day. It would be very hard to get stuck 4 times in a day, show up at a lab exactly when you're supposed to, and they'd probably be closed by the time you need to do your nighttime cortisol testing. So I don't recommend a blood work cortisol test. Saliva is another way that you can test cortisol. You can measure the free cortisol. It has some good parameters. However, there's a much more comprehensive way to do it that we can get some more information and better bang for your buck if you're going to get tested, is to do a particular type of urine testing. There's different types of cortisol urine testing, and there is one type where you just pee into a collection kit and keep it overnight and do a 24-hour test. That has some error because you're not able to see the rhythm as well. So most integrated and functional medicine doctors, and here at our office, what we do is called the Dutch hormone testing, which stands for dried urine test for complete hormones. It's going to test all of your cortisol pattern 4 times throughout the day to see what stage you're in, because depending on what stage you're in, it means that you need different support for supplementation, nutraceuticals, different types of exercises you would do. So you might exercise real hard in one stage and very little in another stage, and it's important to know where you're at. But this Dutch test not only shows the cortisol pattern and the DHEA pattern throughout the day, it also shows the other hormone patterns. And one of the really interesting tests to check for is something called cortisol. Cortisol will steal some of your other hormones. So say you're a 48-year-old female who started a business and then bought a building and then had a tree fall in their building in the middle of a pandemic. And your body's under high levels of stress and making lots of cortisol. What will happen is you have this precursor hormone called pregnenolone. It's one of the hormones that is above progesterone and estrogen and cortisol and testosterone. And under high levels of stress, you'll change pregnenolone, which should make your estrogen, your progesterone, and all of those other sex hormones. It'll turn it into cortisol, which means that you start to go into a place of menopause sooner than you should. So it's really, really important that if you're under stress, especially if you're a female and you're starting to see some changes that you shouldn't be seeing, that you get things like this checked, okay? The Dutch test also tests some what are called neurotransmitters. So neurotransmitters are epinephrine, norepinephrine, so your adrenaline, all those types of things. You can see some of that in the urine where you can't see it in an actual blood test. And it will check your estrogens to see if your body's in a healthy level. So not just the cortisol test, but a lot of other things. So if you're looking into doing some kind of testing, that is a really phenomenal test being used in this country by top-notch functional medicine docs and at Restoring Health.